Hello everybody. About my paper is I went over anxiety disorders. So anxiety is basically like an anticipation that precedes bodily reactions that prepare us for fight or flight. So basically our body, when you have an anxiety disorder, kind of doesn't understand why you're scared or if you should be. It's an unfound fear or anxiety that interferes with a person's day-to-day life or functioning, and clinically significantly distress or life impairment is also like a sign of anxiety disorder. These are all the different types of anxiety disorders, so specific phobias where a person is scared or anxious about a certain topic or thing. So this is a lot where kind of like children come into this, or even some adults, if you're scared of heights, if you're scared of dogs. These are like specific phobia examples. Social anxiety disorders, a lot of teenagers have this and suffer from this. This is where a person is anxious in crowds, meeting new people, and being like socially overall. So these people do not go to concerts or hang out with a large group of people. Meeting new people is kind of scary. Don't really know like what to do or what to say, and they think that what they're doing is dumb. The next one is selective multiism. This is definitely a fear that I have. It's a fear of failing at public speeches, so speaking in front of your peers or anybody just is awfully scary, and you don't want to sound stupid or dumb or say the wrong thing, or your presentation goes wrong. Panic disorder is when an individual suffers from having unexpected panic attacks and is always worried that they will happen again. So say you have a panic attack. With a panic disorder means like you will do anything and possibly can to not have another panic attack. So if you think like having a certain test makes you had a panic attack before the test, they will avoid taking the test, not wanting to take tests. They will basically do anything to not trigger another panic attack. Agoraphobia is where a person must have at least 2 or more fears of using like public transportation. So scared of riding buses, an airplane, or even scared to like leave your house is one. And then general anxiety disorder is where an individual excessively worries. This is a lot where college students, even adults, a lot of people have this one. This is the most common anxiety disorder, where you just excessively worry or stress a little bit more than you should. And lastly, this one is a lot with kids, is separation anxiety. That's where you're overly attached to one person or another person. So this is a lot where the example is like your mom. When you're a baby, everyone has separation anxiety when the mom leaves a room and the baby's crying and they doesn't want their mom to leave. That security blanket is left. So that's separation anxiety. The diagnosis needed for this is obviously you need to talk to a doctor. They normally like to try to do a physical exam to see if there's any biological factors that could be causing any issues, and they will ask about your signs and symptoms. If the patient says I have rapid heart rate, I feel nervous or sweating, always in danger, stressing, worrying, these are all definite symptoms of having any kind of those anxiety disorders I just talked about. And especially if the patient talks about panic attack or having their daily life activities altered, like not sleeping, not doing good at work, or not even going to work, or just wanting to lay in bed all the time, these could all be factors of how to diagnose a person with anxiety. It affects females the most. Children, it's commonly for separation anxiety, specific phobias, worrying too much. In adults, it's more common for panic disorder, social anxiety. Specific phobias are common as well. And Americans are the most common for these anxieties. How it affects daily living. Anxiety causes more stress, so you're always worried and maybe not on top of things. It can cause patient digestive systems, so they throw up or their stomach is hurt because they're worrying so much, always living in fear. Patients have normally a harder time to try new things and take risks and be a little bit more adventurous. They like to kind of stay in their little bubble. Anxiety affects patients' social life and how they also interact with others. Treatment options is, of course, seeing a psychologist and talking about your feelings, and that can help, just saying what you're worried about and how we can talk about coping mechanisms. For example, cognitive behavioral therapy is one. I have done some research, and having an emotional support animal has also helped people with anxiety. Self-care is a great one. That helps with anxiety, staying away from alcohol, trying new hobbies that are healthy, staying active, reducing your caffeine intake. Meditation is a great one as well, trying to be with mind and body as one, and some medications help as well. Lastly, the prognosis is early diagnosis and treatment obviously helps it. Anxiety is treatable, and you can live a full, healthy life with it. All you have to do is learn some managing and coping skills. Thank you all so much for watching my video.